Doctors in Dallas hope virtual reality can help sick babies. Infants born with congenital heart defects often require complex surgeries when they're just days old. Recently, doctors have developed new virtual reality technology that allows them to operate on a baby's heart before entering the operating room. Bianca Castro has tonight's special report.
Yeah.
Her smile can light up a room, as it often does for Rowan's parents, Zachary and Haley Sanders.
Just the fact that she's even here is very special.
Yeah. At 15 months old, baby Rowan has spent half her life in the hospital. Countless appointments and procedures related to her congenital heart defect doctors discovered the day she was born.
When you find out something that serious is going to happen to your baby, you kind of go into this fight or flight mode where you don't have a chance to worry about you. It's more so just, let's do it. Let's get to it. Whatever we have to do, let's get it done.
And for Rowan, that meant complex, high-risk heart surgery at only 18 days old. But surgeons had a plan.
She was moving her hands and she was like, I've already done it and this is my plan and I'm going to do this. And we were like, what are you talking about? And she said, you know, I got to put on these goggles and I did it in virtual reality.
So we can zoom into the heart and then kind of put our head inside it and look.
Rowan surgeons used immersive virtual reality developed by Dr. Ashu Tandon at Children's Health at UT Southwestern in Dallas.
Here's a reconstruction of part of the chest.
In this space, surgeons can virtually step inside a patient's heart, which in reality is about the size of a walnut.
Press it and hold it.
Oh, wow.
It's the latest advancement to the technology he showed me 2 years ago.
What you had was kind of like what you get at the movies, where you get put on the glasses and you get to see depth perception, but you can't be inside it. And so what we've developed recently is the ability to zoom in and be inside the heart. This is the aorta.
And he says this is just the beginning of how VR fits into medicine.
So, okay.
It's quickly becoming a popular tool at medical and nursing schools and for cath lab procedures. But he says its impact will be most felt by families of these congenital heart patients, who make up the largest group of patients relying on surgeons to rearrange the anatomy of the heart.
The whole goal is that the surgeon spends more time thinking about the patient before the operation instead of during the operation.
Good job. And that can give peace of mind to parents like the Sanders.
It's really important to me that people understand what these babies go through. 1 in 100 is a lot of babies.
Rowan will need at least one more surgery in several years, but the Sanders say they're excited for what's ahead. The technology of the future, making a difference in the hearts of today.
Medical technology is just amazing. Think of where we'll be by the time that she is 10. We could probably do this and not have to even, open her up.
Wow, that was Bianca Castro reporting. Doctors say they're also building a library of virtual reality hearts so that they can learn more from former cases. Just incredible. Wow.